So over the last 7 years since passage of the Affordable Care Act, Republicans have made numerous proposals about replacement. None of them have been solid, and none of them have actually been put into legislation and what is called scored by the Congressional Budget Office. One of the common themes is the so-called block grant Medicaid. Remember, Medicaid is a health insurance program for poor people. It's a program that the federal government pays about 57% of the budget, and the states pay the rest, and the federal government imposes some minimal requirements on states. Now, in the name of state flexibility, lots of Republicans want to give states just a block grant, a set amount of money, and states would then be able to redesign how they provide health care to poor people. There are at least 4 major problems with block granting Medicaid. The first problem is, if you give a block grant in 1 year, maybe a good year, the economy may be humming along, but in subsequent years, say a few years down the line, there may be a recession, lots of people become unemployed, they need Medicaid to provide them health insurance, and yet the state does not have the resources because the block grant was defined during a good economic time. That requires the states either to cut back on how many people they cover or tax more and have to fund more to Medicaid. That's a cost shift from the federal government to the states, and it might be inadequate to cover a lot of poor people. Second, a lot of the Republican proposals for block granting Medicaid don't increase the amount of the block grant very much. They tie the increase in the block grant to underlying inflation in the economy. And yet we know that over the last 50 years since enactment of Medicaid, healthcare inflation has gone up much faster than underlying inflation in the economy. So if the block grant increases only at the rate of inflation, over a few years, the block grant will become smaller and smaller and smaller, and again, require the state to pay more for Medicaid. This is just another cost shift hidden inside the block grant proposal by Republicans. The third problem with block granting Medicaid is while it's said to be a way to give states flexibility, we need to remember several things about states and flexibility. The first thing is, designing a healthcare program for poor people is not easy. It requires a lot of expertise, and not every state has the kind of bureaucratic expertise in health policy to design a good program. Second, we also need to remember that not all states are good administratively and pristine or uncorrupted. A number of state governors have ended up in prison because of malfeasance, as have state legislatures. In addition, in a number of states, particular interest groups in the healthcare marketplace, whether it's insurance companies or hospitals, might have a disproportionate influence on state legislatures, and they may not have the best interests of poor people at heart in designing a Medicaid proposal. So some flexibility might be present, but it may not lead to better health care for poor people. So block granting in general is probably not an ideal proposal for providing health insurance to poor people. We need to think of other alternatives besides block granting Medicaid.